Welcome to the Connecticut Health Policy Project's video primers on Connecticut's healthcare system. This second video is about the uninsured and underinsured in Connecticut. Between 1999 and 2010, Connecticut's uninsured population grew from 7 to 11% of us. It dipped in 2011 for the first time in 6 years to 8.6%, largely due to early effects of national health reform. But that still leaves 303,000 state residents without health coverage. The rising number of uninsured in Connecticut is due to the rising costs of health insurance. From 2001 to 2011, total premiums for single employer-sponsored coverage grew 72%. For families, it rose even more, by 85%. But over the same years, household incomes didn't keep up, only growing 23%. 1 in 11 Connecticut state residents lacks health coverage. That's more than the total number of state residents in these 56 occupations. The number of uninsured is larger than the combined populations of Hartford plus New Britain plus Middletown. If everyone uninsured in Connecticut all moved to live in the same place, that community would be larger than 5 counties. Connecticut's uninsured are not evenly distributed around the state. Residents of urban and inner-ring suburban communities are far more likely to be uninsured, although no town is immune. Despite great wealth, Fairfield County communities have consistently higher rates of uninsurance. There is a persistent myth that affordable coverage is widely available and that the main reason people are uninsured is because they choose not to buy it. The truth is that only 7% of uninsured Americans don't believe they need coverage. The vast majority of uninsured state residents simply can't afford it. Connecticut's uninsured tend to be single young adults without a college degree. Most are employed by small businesses. Connecticut firms with under 50 employees are half as likely to offer health benefits as firms with over 50 workers. Most job creation in Connecticut has been in small businesses in the service sector, the least likely to offer benefits. Half the uninsured are temporary or part-time workers who are not eligible for benefits at work. About half of non-citizens are uninsured, but they are a small portion of the total uninsured in Connecticut. Many uninsured are in poor health. 1 in 5 uninsured adults has a chronic illness. Most uninsured Connecticut residents are not eligible for Medicaid. Currently, Medicaid is mainly available to families with children, pregnant women, seniors, and people with disabilities. Next year, with national health reform, Medicaid will be expanded to low-income state residents regardless of family circumstances or age. There's another persistent myth that the uninsured can get free health care when they need it. It may be inconvenient, but it's available. The truth is that the uninsured often cannot afford the care they need. The uninsured pay the highest prices for health care, not the discounted prices negotiated by insurers and government programs. Almost 2/3 of bankruptcies in the United States are caused by high medical bills. Being uninsured affects people's health. The uninsured are less likely to get care in emergencies, are less likely to get recommended screenings, and more likely to be diagnosed with a disease in advanced stages when it is harder and more expensive to treat. 1 in 8 uninsured hospital stays could have been avoided with better access to care and early treatment. The uninsured are half as likely to have visited a doctor in the last year. Uninsured car accident victims receive 20% less care and are 37% more likely to die of their injuries, according to a large study. 1 in 7 uninsured spend more than 1/10 of their income on health care, and almost 1 in 5 have been contacted by a collection agency in the last year about unpaid medical bills. Taxpayers fund 3/4 of the care for the uninsured. For more information and video primers on Connecticut's healthcare system, visit the Connecticut Health Policy Project website. For updates on healthcare in Connecticut, follow our Connecticut Health Notes blog. And for more resources on Connecticut's healthcare system, visit cthealthbook.org.